past 17 years, I had not had any positive pregnancy test in my life.
This couple came all the way from Zimbabwe for treatment. The history is that they are married for 16 years and had 2 failed cycles of IVF in South Africa before reaching out to us. So this is a complex case in that she is 40 years old, which we say as advanced age for fertility treatment. In addition to that, her egg numbers are also low, which is commensurate with her advanced age. In addition to that, she has multiple fibroids and she has already had 2 myomectomies, that is, surgeries to remove the fibroids in the past. On top of that, this couple can stay in India only for 3 months for treatment. So this is a very challenging case, and how did we deal with it? So as I said before, she's 40 years and already has low egg number. Usually when there is a fibroid, particularly the largest fibroid size was 7 centimeter, we would ordinarily suggest fibroid removal, that is myomectomy. And if we do the fibroid removal, I have to further wait for few more months, and she's already 40 years with low egg numbers. So what did we do in this case? We did a hysteroscopy to ensure that there are no fibroids coming inside the lining of the womb and there are no scarring. So once we did the hysteroscopy and it was clear, after adequate counseling, we went ahead with the IVF treatment. 6 eggs were collected and 2 blastocysts we got, and it was replaced. On day 12 post-transfer, beta HCG level was 776, which is a very good positive. Couple were overjoyed because, as I mentioned before, the 16 years of married life and 2 failed cycles with multiple fibroids. So post the positive result, she flew back to Zimbabwe, had the antenatal care. So the challenges in this case is not just one. One is advanced maternal age. Second is low egg numbers. Third is multiple fibroids in the uterus. In spite of all these challenges, we could still achieve a positive outcome. So, failed IVF cycles in the past doesn't necessarily mean it is the end of the journey. We always have to look into the case freshly, assess both partners again, and if there is any specific issues to be addressed, we have to look into that and then offer the IVF cycle again. As in this case, we had a real good outcome even though she has failed IVF cycles in the past.
It wasn't an easy journey at all. There's so many times I wanted to give up. I had unsuccessful IVF trials twice in South Africa. Maybe IVF is just not for us. Maybe having children of our own is just not for us. You know, doctors are telling me I have fibroids, but I can actually have baby of my own. So 2024 in March, Dr. Vyjayanthi and her team came to Zimbabwe. So my first impression when I met Dr. Vyjayanthi, I liked her confidence. I liked the way she gave me so much hope. So that statement of its own gave me trust, gave me hope. And we have been trying for a baby for 17 years. So I lost friends, I lost my family, relatives, I lost even the closest people that I had to me. I had my transfer done on the 23rd of December 2024. I found out I was pregnant on the 1st of January 2025. Yes, I was still in India. Dr. Vyjayanthi did the pregnancy test, and when it came out positive, she said, okay, Pinky, let's do the blood test just to be sure. My beta HCG was very high, and I remember vividly Dr. Vyjayanthi's words. She was like, Pinky, with these numbers, I'm 100% sure that you're pregnant. I remember falling down from her chair. I remember crying. I remember tearing up. I remember, holding her gown. I remember just saying thank you. I remember, I'm getting emotional. I'm just going back to the moment. It was a priceless moment. For the past 17 years, I had not had any positive pregnancy test in my life. I'd never missed my menses. I'd never had a positive pregnancy test in my life. So this was something that was magnificent. It was an answered prayer. It was marvelous. It was beautiful.